Hello and welcome to our special session of World Environment Day 2025. My name is Simran Chaudhary and I welcome you all on behalf of Voice of Healthcare to our special session focusing on future proofing healthcare, a climate conscious approach. We know that this year's theme is Planet Plastic, put an end to plastic pollution, which highlights the urgent need for the healthcare sector to address this environmental impact. And for this special session, we are honored to have Dr. Raj Shankar Ghosh, Senior Advisor, Environmental Health at PHFI, with us today. Dr. Ghosh will share insights on the key environmental challenges affecting public health in India, the importance of climate resilient health systems, and how healthcare can adopt sustainable plastic free practice. Welcome to our show, sir. It's a pleasure having you here.
Thank you. Thank you very much, Simran, for inviting me for this conversation.
Thank you so much, sir. So, Dr. Ghosh, to begin with, could you share from your lens what are the most pressing environmental challenges currently impacting public health in India and how urgent it is the need to build climate resilient health systems?
Great. Thank you for this question. Let us put this in a framework. What does environment and the entire change that is happening cause to human health? We can put it in a framework which we call the D framework. The first is the various kinds of disasters that happen, natural disasters. Many of them are man made disasters. If we talk about plastics and pollution, the theme of this year, there are lots of disasters that happen because of irrational use of plastics. The second D is about the various kinds of diseases that happen, both acute diseases like acute respiratory infection, and then there are chronic diseases. We are increasingly finding the relationship between environmental change and mental health around long term physical health consequences and also the social well being. The third D is about the various displacement of populations that happen because of the disasters and the diseases. During COVID, we saw that there was a large displacement of populations. And if you link diseases like COVID, the pandemics and the emerging diseases, there's a very strong connection to how we have managed our climate and environmental issues. And then, and with the displacement, the human population becomes exposed to newer kind of health settings. And the fourth D is about the various kinds of disruptions in livelihoods that happen. And that results in, the affects the socioeconomic position of families and thereafter, all the health issues. But the two most central Ds that are very, very important is that diversity, that, this this impact and outcome of the environment change is diverse from geographies and from population settings and all of that. And the other very important D is about the disproportionate impact, that there are populations who are disproportionately affected by the environment and climate change, and that there is a vulnerable group of population across gender, across socioeconomic status, across where they live, and the geopolitics based on which they are disproportionately affected. If we look at it, direct impacts, there are extreme weather events, as we are seeing around extreme heat. There are various kinds of vector-borne diseases which are kind of re-emerging, which are more disproportionately affecting the vulnerable population. There is the whole issue about air pollution. There is a whole issue about change in agricultural practices because of environmental changes leading to food security and malnutrition. And the final thing is that because of all of this, there is a lot of stress on the health infrastructure. So therefore, I think with the environmental issues that are coming up, there's a lot of impact on the human health across all of these fields.
Definitely, sir. And because of
Yeah,
all these climate changes, like you mentioned, we are seeing a lot of newer diseases, newer
absolutely.
problems, I think, which were not
Yes.
there earlier as compared to the current time. And This is
Yes.
because of the kind of every kind of pollution and the climate change we are witnessing. And so, since we're
Yes,
talking
indeed.
about this,
Absolutely.
definitely, sir. So, how can we better integrate environmental health into mainstream healthcare policy, planning, and medical education? Because I believe this is very important step currently to educate our public, educate our medical fraternity, so that we can take actions on time.
Very good question, actually. So, when we talk about integration, we will have to integrate into three kinds of uh, domains, and we call it the three P domains. One is about the whole issue of policies, the health policies that we talk of. For example, if we look at India in particular, we have the National Health Mission, and there are various kinds of policies which drive the National Health Mission. Climate and health needs to become part of this larger national health mission policies and all of that. The second is about the programs. Again, if we look at the various kinds of programs that are there, the health programs, the various kinds of programs that are related to providing safe food, safe water, the whole wash issue, we really need to integrate climate into the climate and human health into these larger programs that are there. The third area is about the practices. Now, one thing that we will have to understand that communities have been harboring very late, very long, traditional practices that they have to, encounter the various kinds of climate changes, the environmental health issues that have come up within their community. These practices are actually local knowledge on which we should, further develop. For example, within the tribal populations, there are various kinds of practices that they have. We should really study them well and see that whatever we want to introduce does not disrupt their current practices, because current practices have been based on very long periods of learning which has come down generations. And then it comes to the fourth issue, which is about the capacity building, that we really need to kind of ensure that we are able to spread the awareness. We are really, able to educate the community and the various kinds of stakeholders. So there's a very nice kind of pathway that we have in public health, which is called the A pathway. The A pathway talks about, beginning with awareness, that we kind of impart education to the community and make them aware of the various issues with environmental health or any public health program. The second part is that the community or the stakeholders act on it. That's the second day. Once they have started acting on it, they adopt it in their day-to-day lifestyle and their kind of day-to-day activities. Once they have adopted it and they find it that it is bringing some positive change in their lifestyle, they become advocates for it. So they then kind of are the champions who take the whole message forward, and there is a ripple effect. So it begins with awareness, leads to action, leads to adoption of those practices within the community, and then finally the community becomes the advocate of the change that we want to bring.
Very rightly said, sir. And then the community becomes the advocate for the right change we are demanding for. And it's a
Absolutely.
long process, long way to
Yes,
go, a big chain to follow. But that is possible as this is needed.
indeed,
Any
indeed,
any
indeed,
any
indeed.
number of times, which I say
Absolutely,
is less because we are facing those issues currently.
indeed.
So, One Health has emerged as a powerful concept connecting human, animal, and environmental health.
Absolutely.
Could you share its relevance in today's policy and public health discourse?
Yes. So, first of all, we need to understand that, in today's world, the health of humans, the health of animals, and the health of the environment are very, very closely related. There is a very nice saying that in today's world, what we need to do is help. HELP stands for health, education, livelihoods, and the planetary health, which means the environment. So, if we are looking at One Health, basically there are four things that we need to understand. We have a very deep understanding of the zoonotic disease prevention and protection uh, plans, policies, and the practices. We have sufficient knowledge through research on the human health, the integration of the various kinds of evidences that we are generating from the zoonotic diseases must become a part of the human health and the animal health and the environmental health platform. The second thing that we need to understand is that there are certain priorities that we will have to protect. For example, if you see, antimicrobial resistance is becoming one of the major kind of public health challenges that we have. And this can be addressed only through an integrated approach of protecting human and animal health, and also focusing on the environment by various actions like sewage samplings and others. The third thing is, we had a whole discussion about how we are going to bring climate change into the focus of human health by talking about the 4Ds that we talked about: the disaster, disease, the kind of disruption of livelihoods and the displacement of populations. Central themes being the disproportionate impact, and also in terms of the diversity. So we need to bring this into the dialogue. But another very important issue of One Health would be around the food and water safety, because that's very, very important for us. So the organizations like Food and Agriculture Organization, the World Health Organization, the World Organization for Animal Health, all of them are working towards developing an integrated strategy of One Health to be implemented across countries, because today disease knows no border, and therefore we will have to have practices, policies which are contextualized locally but applicable into a global kind of setting.
Very rightly said, sir, because disease knows no border,
Yes.
and globally, if it is not implemented, then we could see more of, God forbid, nothing comes like the COVID-19,
Indeed,
which we
indeed.
saw. But I think that is the correct example of what we just discussed, and it shows the importance of how urgently we need it.
Yes.
So, given this year's World Environment Day theme, we know that it is put an end to plastic pollution. How
Hmm.
critical is for the healthcare sectors, one of the largest plastic waste generators, to take accountability and action, because we know the kind of waste is generated from the pharmaceutical organizations, the hospitals, and many other sectors in healthcare, organizations in healthcare. The waste is
Yeah.
there. So how can we manage them and become a sustainable healthcare
Absolutely.
sector?
So yeah, before I delve into this, so before I forget, that I'll be sharing with you a webinar that we had day for yesterday on particularly this issue about plastics use, and how we can really kind of take some concrete steps. Please share it with your audience. I'll share it with you later. There are a few things that we need to understand very, very critically about plastic, and how do we really end this use of or rationalize the use of plastics in healthcare. The first thing that we need to understand is India has one-fifth of the world's burden of plastic pollution. We create 20% of the world's plastic pollution. The second thing that we need to understand very clearly is that hospital settings are one of the infrastructures where the plastic use is very random, and there is a way that we can actually put an end to it. There are various kinds of solutions. What are the challenges? I think most of us know it, but still, once again, I will repeat. One is obviously the whole issue of the microplastics and the health risks that we have. There are various kinds of contamination of the water, food, air that happens because of microplastics, and that affects our health. Today, there are very strong evidences that it not only affects the physical health, but also the mental health. And because of the various kinds of chemicals that enter the body. The second is that the plastic, if consumed by the stray animals and others, this really causes fatality amongst them. So therefore, it becomes a very big risk for them. The third thing that is there is that plastics also kind of clog the various kinds of sources and water sources and other sources, and therefore, they cause a lot of human health issues. So, having said all of this, there is a very concrete way that we have to move forward on this. There are some global initiatives, and this year, as you know, the World Environmental Day, the is being celebrated, particularly or being hosted by South Korea. They have been one of the champions in the plastic, being putting an end to the plastic pollution, and there are lots of lessons that we can learn from them. And this uh, goes through the whole issue of policy and regulation. There is a lot of focus on plastic waste audits. Organizations like Healthcare Without Harm have developed some very good tools that we actually plan to apply in the network of hospitals that the Public Health Foundation of India has, called the Health Environment Leadership Platform, a group of private hospitals across India. And these audit tools are very, very important for the hospitals to assess their own status. And then there is a very important issue about sustainable procurement, that when we do the procurement for various kinds of things, we should be very careful about what are the materials that are being used, and absolutely no to single-use plastics. And we will have to kind of address this through regulatory, through procurement processes, through our practices. And the most important thing is by training and also educating the various kinds of end users in the hospitals and other settings about how plastics need to be judiciously used within the healthcare infrastructure.
Rightly said, sir. And thank you so much for answering that question and giving us that insight how it works there. And are there any promising examples or models of sustainable healthcare infrastructure or operations in India or globally that we should learn from? One you just mentioned about the South Korea.
Absolutely.
Any other thing you would like to mention or bring take it out?
Yeah. So there are, various hospitals within our health and environment leadership platform, and anyone can freely visit the website of the health and environment leadership platform and see as to some of the practices that they're taking. But we are now kind of collating some of the good practices. A compendium will come out very soon from the Public Health Foundation of India about the rational use of plastics and how we are kind of putting the uh, policies into practices. And we'll share that with you. Those can be seen. The change must happen at every level, starting from the primary health and wellness centers, from the various kinds of primary healthcare setting, primary healthcare facilities, at the secondary and the tertiary hospitals. There are various kinds of private sector groups, and all of them, including the Apollo Group, the Max Group, and the various others. I don't want to name any particular group, but all of them have an environment sustainability kind of commitment. And in the environment sustainability commitment, there are various kinds of practices that are being done in India. One thing that we will have to understand is that unless we really address the procurement issue, things will not change. And to address the procurement issue, this has to be a central and a state level initiative. And this has to be taken up by the various regulatory agencies, by the various pollution control boards and others. And therefore, we would really look at the bodies like the NABH, the National Accreditation Board of Health in India, and other kind of accreditation agencies to enforce the rational use of plastics according to laid out guidelines that are there across the globe and also locally made in India. Indian Council of Medical Research has some very good guidelines on the rational use of plastics, and these have to be applied, but with regulation, with audits, and also ensuring that there is education and capacity building of the people who are going to use it.
Definitely, sir. It needs to be done at larger basis. That is the
Absolutely.
central and the state level. Then only I think we could, try to or bring it to control. Once it is
Indeed.
regulated, then people will be conscious about how to
Absolutely.
do it, how not to do it. Thank you so
Yes.
much for that opinion, sir. And since we're talking about this, what role do research and data play in driving evidence-based advocacy for sustainable and environmentally conscious health system? Because we know the research plays a larger role, a bigger role
Yes.
to see what is coming up.
The role of research is very, very simple. There are three ways that research helps. The first way is that research generates data, which helps in evidence based policymaking. The second part research plays is that it does generate data, and data helps monitor programs to understand how effective some of the interventions that we are taking in terms of the action. And the third role that data has is to really kind of motivate the policymakers and the ones who hold the financial kind of power to see that the impact that is being made is meaningful and is going to kind of bring about positive changes. So data will be used in these forms. Data actually is a very kind of interesting term being used these days. We say that data is actually digitized, accessible, timely, actionable information. That's the acronym that we are putting data for. And data is not a standalone activity. Data generation comes with responsibilities. You just cannot generate data and leave it there. So, what we do is that in public health, data is a linear process. And what we say is that data is the first step of generating data through research. Then, what we do? From the data, we make a diagnosis, and that is why it is called the D-linear path. From the data, we make a diagnosis about what is the problem. Based on the diagnosis, we design our interventions. The interventions can be policy interventions, can be program interventions, can be practice interventions. Based on the design of these interventions, we do some demonstrations in hospitals or in other places to see as to how effectively the design is working. Once we have done that, the next D comes, which is the documentation of the demonstration. And finally, the documentation needs to be disseminated. So when we are talking about data, it is very, very important for us to be responsible data generators based on which we will identify the problem, diagnose the problem, will design interventions, we will demonstrate some of these interventions in practice, we will document them and disseminate them to a larger audience so that we can collectively act on public health problems like pollution, like plastics, like any of the environment and climate change and human health issues that we are talking about.
Definitely, sir. And this all comes with, administration and
Absolutely.
behavioral change. So we also discussed
Absolutely.
about that. So I'll just not go there. As we are coming into our discussion, lastly, I would ask, what message would you like to share this World Environment Day with healthcare professionals, policymakers, and the public to inspire a collective shift towards environmental stewardship in health?
The only thing that I would say is that, whatever we are trying to do in terms of, having a greener planet, none of us, neither Simran alone nor me, can do it alone. We will have to do it collectively, all of us together. For that, I will say that we need to educate ourselves. Please educate ourselves so that, we can do the action. once we have seen the action works, let us adopt that in our day to day practice, in our own lifestyles, and also in our workplace. And then let us become advocates. So, as I said before, everything starts with awareness. We really need to make ourselves aware. We need to make that extra step so that we learn more about the problem and the solutions and ultimately become an advocate for the change that we want to do. We have to do it collectively together. And obviously, this year, we are talking about beat the plastic pollution. Let us collectively beat the plastic pollution with awareness and with our practices. Thank you.
Thank you so much, sir, for sharing all your experiences, insights, and opinion with us because this matters a lot. The kind of experience you have, the kind of knowledge you are helping us to disseminate amongst our viewers and audience out there. It means a lot because, like you said, the change starts from our individual level. Not only you and me can help to make this, but
Absolutely.
we have to collectively make this effort and to make it actually possible out there. And then we
Indeed.
would definitely require help from our policymakers from at
Absolutely.
center level, then the state level, and the regulatories. So thank you so much for sharing all this information and helping us to create awareness on this World Environment Day. Thanks a lot, sir.
Thank you. Thank you. Pleasure.
Thank you so much.